Oh, alright. No. Yeah. Thank you, Jerry. Now, take a look here. This is what I wanted to kind of get to you. Look at it. You see the free edge here? Look. This is the tentorium here. Tentorium is coming up. A piece of it is kind of going towards the anterior clinal process. And a piece of it will be towards the posterior. The point I want to make is that there is a roof section here, and in that roof section, this nerve goes through. This nerve here, you can make it up? This nerve is a big nerve. This is what nerve? It's going through the roof right here. Right underneath here, right here, in that black, dark part here, is the cavernous sinus. And right here is the roof. What is this fellow perching on the roof? The oculomotor. Oculomotor. Don't forget that. He's perching on the roof. This is the oculomotor. That's it. That's the oculomotor nerve. So he comes in on the roof, and then when he goes inside, he goes in gets into the lateral wall of the cavernous sinus. This cavernous sinus is very important because it's a space where blood can drain from the eye, okay, from the orbital cavity. And since it can drain from the orbital cavity, it can also drain from the face. From the face. And if someone has an infection in the nose, an infection, we call it the middle face, the mid face, then you could get infection draining back through the inferior ophthalmic vein, and it will drain back into the cavernous sinus. And the cavernous sinus is a place where vessels from the cerebrum drain, and vessels from the wall, so the meninges, the cerebrum, the sagittal sinus, have connections. Because once you get into that cavernous sinus, remember these sinuses do not have any valves. And if the thing has no valves and germs get inside there, they are free to go anywhere that is connected to the area. You follow? Right. So the cavernous sinus, one of the clinical conditions we have is cavernous sinus thrombosis, and that is a very serious condition. You follow? Because stuff from the vein from the brain is draining into it. Stuff from the eyes, stuff from the face. It's a conduit for organisms going towards the brain. So you could get a serious mid-face infection. You could get abscess in the brain. Okay. All right. Okay. Let's go to something else. All right, what's this bone? Atlas or axis? Which one? Who say atlas? Who say axis? All right, remember, I don't know whether you did these things in school, but you should have heard some Greek stories about the man who had the world on his head. Who was that man? Atlas. Yes, right. This is the Atlas. Atlas has the whole world on his head. Okay? So this fellow, and if you look at the superior aspect of the Atlas, you see how this is called the lateral mass. The lateral mass is kidney shaped. Kidney shaped. Lateral mass. It has no body. Has an arch, a short anterior arch, and a long posterior arch. Okay? And on the underside, its articular process is flat and ovoid. Flat and ovoid. Alright? On the superior surface, superior side, you can see the cup. It's cup shaped. So the condyle of the occiput, you see the condyle? Sorry. Right, the condyle can sit in the cup. Right, so this is the occipital condyle, and this is the, what you call this? Atlas, but what you call this particular part here? The superior articular facet, and it is concave. Concave. You can see the cup. Right. Okay. And this, remember, the underside is flat. The second bone now, second bone is the axis. The axis allows for rotation. So if you notice, the articular facet is not like is not concave. It's kind of a little convex, and it doesn't make sense if you want something to rotate. You can't make it like a cup. The size of the cup won't get in the way. So you make it convex. Remember, intelligence is built into the system. It didn't just arrive and say, I'm here, like magic. Explosion. Alright, so look. See this fellow? He can sit. The Atlas with the world can sit on the axis, and a little rotation can occur easily. Alright? Right. Now, the body which is missing from one, alright, this has a missing body, so the body is made by this fellow. Okay? I call this projection a down-down process. Good. Inferior surface of the atlas, of the axis, atlas, who has the world and his head, his inferior surface is pretty flat. Flat and ovoid. So that rotation can occur easily. Right? When they used to hang people, what they would do is put the people on a platform, and then they would tie their neck, and they would move the platform quickly. And then when the platform is moved, there would be the movement of this bone. Oh, sorry. This bone, the odontoid peg, would move posteriorly. Alright? And when it does that, it would go into the spinal cord. Right? You get it? So there will be compression. You will also have the tendency to rupture the annular ligament, which is holding the peg in place. So that will occur. Alright? Sorry, I didn't have it. I didn't have it. I didn't have it sitting right here. This would be its normal position. So when you bend like that, you see, this would go back posteriorly, and then it would be the odontoid peg pegging into the spinal cord. Yeah. Okay. Now, one of the things about these cervical vertebrae is that they are special. They have a special, something special about them. Table 1, what is special about them? Every cervical vertebra. Sorry? Foramen transverse area. Okay. So if you look on the side, there is a foramen transverse area, right? And that's a nice word because it's in the transverse process. Foramen transverse area. So I go further down, I pick up a cervical vertebra, and on the side I have a nice foramen transverse area through which the vertebral artery will go. So I can recognize cervical vertebra by looking for the foramen transverse area. If I have that, it is a cervical vertebra. No other vertebra has a foramen transverse area. All right. Now I want you to take a look at the body. Look at the body of the vertebra. This is a cervical vertebra. And if you look at it well, you notice that the edge is high. Okay? Look. Two edges are up. They will form joints with the neighboring bone. What do you call those joints? You can have them table 2. Table 3. Joint right here. This elevated area on the body, on the lateral side of the body. No man, the name of the joint. Yes. Name of the joint. I don't want any nonsense answer. I want a good answer. Table 4. Help them out, table 4. Everybody is trained in silence. Eh? Okay, that's referred to as an oncovertebral joint. Oncovertebral joint. Oncovertebral joint. Yeah. Okay. Now, if you look at the body of the vertebra, the posterior part of the body, it's very holy, a lot of holes inside it. What veins go inside it? Very good. BC vertebral veins, the BC vertebral veins. And tell me one feature of these BC vertebral veins. They connect internal and external aspects of the vertebra, and they, very important, have no valves. So sometimes they refer to as the forming the plexus of Baxter, right? And remember that this goes up and down, and right down to the pelvis, So let us say you have a patient with cancer of the prostate, or he has myeloma disease, then it's easy for the metastases to spread through these basic vertebral veins and ascend up, even to the skull, easily. Okay? Alright, the basic vertebral veins. The holes, look at them, man. Very holy. You see them? On the posterior. You see them? If you need a close up, you can always come afterwards. Or if you look here, I have the axis, and look at the back of it. You see the base. You see you see the holes, right? So even on the neck of the bone, we have the holes. Yeah, anterior cartilage, very porous. All right. What's the name of the joint on top here again? Uncovertebral joint. Uncovertebral joint. Right. Now, here I have another vertebra, and if you look at this vertebra, you see a smooth area right here. And you see another smooth area here. What are these smooth areas for? These smooth facets are for what? For the ribs. Right, so what will go here? Which part of the rib? Which part of the rib would go in here? And this would be a hemifacet. Hemi means that there is a connection for two sides of the head of the rib, because the rib has two demifacets, two halves, two hemifacets on it. So the rib head is going to be here, and what is going to be over here? The tubercle of the rib. And what will be the space between the two cards? The neck. Boy. All right. Yeah. Okay, let's go on to some other. All right. You recognize this bone? Anybody recognize it? What is this? Squamous temporal. Very good. And there is a little angle across here. Let me show a whole bone. Okay, here is a bone, whole bone. Good. So just above the external auditory meatus, right? And also you can say that near the root of the zygomatic process posteriorly, there is a little angle right here, or sometimes referred to as a little triangle. So the root of the zygomatic process going lateral here, and then you have the mastoid coming down. So right in the space here, you have a little triangle. What do you call that? Mackiewen's triangle. Mackiewen's, M-A-C-E-W-E-N. Or you might say M-A-C-E-W-A-N. Mackiewen's triangle. What's the significance of that? It's very important for mastoid antrum surgery. Sometimes patients can have abscesses in there, And this is where the doctor is going to use that as a landmark to get into the mastoid antrum. About 1.5 centimeters below this, deep to this, you will find the mastoid antrum. And sometimes a patient with significant mastoiditis might have pus that has to be drained. And so this is an extremely important landmark, McEwen's triangle. Somebody might just put an arrow pointing in that area and direct a question to see whether you know this important point, whether you know this important triangle. All right? Just in this vicinity here, what we have here? The asterion. Remember the asterion like a star? Asterion. And what if I bore a hole inside it? Where will it take me into? The lateral part of the transverse sinus. So you don't want to make holes, bore holes inside it. Huh? You're trying to drain blood. You'll get blood coming out, but you're only helping the patient. All right. Okay. All right. Now, what we call this table one. This table one. The point is the compact bone of the inner table of the frontal bone. Okay? Compact bone of the inner table of the frontal bone. The outer table is here, and this space here is made of spongy bone or cancellous bone. Right, so spongy or cancellous, outer table, inner table. Right. Tell me 3 vitamins I need. 3 vitamins that I need for the bone. Good bone structure. Huh? All right, I need even to form the bone, to form the bud of the bone, the limb bud. What do I need? Which one I need? What's the substance I need? E and A especially. The particular acid is what? Retinoic acid. Retinoic acid, yes. Yes, I need that to form the limb bud, so the bone formation needs that. What else I need to help with the calcium laying down? Vitamin what? D. Good. What are some of the 2 substances I need for that? The vitamin D. I need some sunlight. What will the sunlight do? Huh? Seven dehydrocholesterol. Yes. What it will do? Convert it to. What do I need for the liver? I need to make the 25 hydroxycholecalciferol. And then, what I'm going to do with it? I'm going to need a 1-alpha hydroxylase. Where are we going to get that? In the kidney, right? And that is going to convert it into 125 DHCC. 125 dihydrocool. And then, with that, what will I do with that one? With respect to calcium, what will I do? What will it do? What's the action of 125 DHCC? Increase absorption from where? From the gut. What else? What else will it do, Stephen? On the kidney? Increase absorption of phosphate, so that, why I want to do that? To change the solubility product, CaPO4 ratio. Alright, so as I cause phosphaturia, I'm able to raise my phosphate, raise the calcium. Right, so I get a higher calcium level for bone deposition. Okay? Right, so it will cause phosphaturia, it will increase calcium absorption from the gut, so as to increase the levels, and it will increase the rate at which the calcium can be laid down in the bone. Alright? But I also need another vitamin. Vitamin C. Yes, because bone needs to be laid down. And the collagen has to be formed to lay it down in. So what will the vitamin C do? Stephen, what will the vitamin C help with? Table 2, tell them. Table 1. Oh, sure. Lysine hydroxylase. Yes, activity is going to be increased by vitamin C. Yeah, man, good. Tell them table 1. All right. Okay. All right. Okay, let's move on to something. Alright. So we have here the spinal cord. Table 1.